Hello, thank you for watching the Recharge Your Life online video series. I'm your host, Phaedra Antioco, and I am a pain and trauma relief coach and help people regulate their nervous systems to feel safe in their body. And I found so many times that there's often these hidden traumas that we've experienced in life through divorce, death, disease, debt, or just disappointments that get held up, trapped in our body, and can even further our health issues. So right now, we are going to be talking with Dr. Elena Villanueva as we explore finding the root cause of mental health disorders. But first, let me tell you about Dr. V. Dr. Elena Villanueva is a functional holistic medicine expert and founder of Modern Holistic Health, a multi-clinician practice that focuses on and restoring brain chemistry imbalances and reversing mental health disorders and neurodegenerative diseases. And Dr. V uses genetically tailored data-driven approach to treat the underlying root cause of both mental and chronic illness and disease rather than covering symptoms up. Dr. Villanueva and her team specialize in restoring and reversing chronic mental health conditions, including anxiety, depression, schizophrenia, bipolar, ADHD, Parkinson's, all of those brain's issues. And her passion and commitment to ending the stigma behind mental health and exposing data-driven systems and finding the underlying root cause is needed now more than ever. So please join me as we talk to Dr. V about the root cause of things that are hurting you, harming you, causing you disease, causing that depression, and causing that dementia. Thank you so much for being here, Dr. V. I know you've had your own healing journey and you help people who are struggling with the mental health side of things, the emotions, the depression, the anxiety. So thank you for being here.
Thanks for having me. I'm super excited to get to join you today so that we can, educate people and tell them some stories and inspire them.
Absolutely. And what I appreciate is for you as a practitioner, you have been there in your own healing journey, in the trenches looking for healing solutions. So do you mind starting with sharing your story, your struggle, and how you overcame
Yeah, absolutely. I find it really amazing and interesting that most healers had to go through the healing themselves.
it?
And I feel like that gives us an edge when we're working with our patients and our clients, because we can empathize with them, because we actually have had to walk through the fire ourselves to get ourselves better. But my story is kind of a little bit of a crazy one, and I feel like I'm really lucky that I'm still here. I struggled with with some depression and anxiety, probably from the time that I was a young teenager, but it was never bad or incapacitating in any way. I think I just felt like it was just a normal part of life because I had had it, since I was a child. And um, it wasn't until I became a single mother that level of anxiety and depression went up a notch. Again, it was still, I was still able to function through it.
Mhm.
Although I started having, my very first episodes of like not being able to pull myself out of the bed and having to call in like a sick day. That started in my 20s. And, as a single mom, it's so hard. And those of us who have had to walk down that route, only we really understand that. But at the time, I had been a military wife and had put my university schooling on hold so that we could have our baby, and plans changed. And so when I went out on my own as a single mom, I didn't have the degree. And so, immediately I started putting, self-limiting beliefs on myself that I didn't even realize that I was doing. I didn't even realize that I was doing that. So I felt, I started believing things like, oh, nobody's ever going to want to marry me because now I'm ruined. I've got a kid. I don't have my degree yet. Nobody's going to want to date me because I don't have a high enough education. I'm not going to find anybody worthy. Maybe I'm not worthy enough. Just all these things started going on in my head. And when I look back on that, I can see that I had created a situation for myself that was undesirable, because in fact I was worthy and I was intelligent and I was amazing. I just didn't believe that after going through the traumas of separating from somebody that I had loved, right? And so there was struggle there, with work and trying to provide for my kid, and trying to be the strong one. And I was super fortunate at some point. I was able to go back to school and finish my undergrad, get my doctorate. And I, came out of my doctorate program, graduating and going right into practice. I'll never forget that I saw my first patient on Thanksgiving Day. And there was a medical doctor in town, and I had rented space from her. And she was, right out by Lake Travis, right outside of Austin, Texas. And she called me and said, there's a patient with severe back pain and he can't stand up straight, and I'm on holiday, and if you want this as your first patient, I'll go ahead and give them to you. So of course, I'm like running in, and that's how I celebrated Thanksgiving. And I was super happy. It was my very first patient. And I worked super, super hard to become successful because I didn't want the struggle anymore. So my whole motivation for getting through school and getting my doctorate is so that I could become successful, and so that I could be worthy, and so that I could be that person that I wanted to be. And I worked very hard.
For a minute though, I want to ask you, because I know
Yeah.
there are women watching that are probably in this situation, and it's like, how do I pick myself up again? Do you mind sharing, kind of, if you could think of it, what you did to help you make the decisions to get up out of bed to start getting into school? Because that's not easy to really make those changes in your life. What were some of those self-care habits you did?
I did a lot of praying, which I guess you could look back and say that was a form of meditation.
Mhm.
And, at that time, I couldn't afford yoga classes, and I couldn't afford psychotherapy, and I couldn't afford, I was uninsured and just rubbing pennies together. But I was very, very resourceful, and I had a kid. And so really, it was wanting to change, wanting to not have my child walk down that same road
I
of
bet that
struggle.
was, oh, I bet that was painful for you too. And that was part of your motivation.
That was the majority of my motivation. I, as bad as I felt for myself, I had to get up every day because I saw this little 3-year-old boy looking at me in the morning, going, touching my face and saying, "Mommy, are you okay?" And I knew that I had to pull my stuff together, as hard as it was. And there was a lot of struggle, and there were times that I didn't know how I was going to feed my kid. And I remember one time waiting for the eviction notice to come on at the apartment, and I was just absolutely mortified and couldn't believe that I was living in that nightmare. And I did a lot, I had a lot of prayer going on, and I was super resourceful. And what came to me, what the universe or what God brought into my life to help me, was nothing short of a miracle. And I just so happened, he made it so obvious, or the universe or God made it so obvious to me that this is what I needed to do, so that I could have the doors open for me, so that I did end up losing my apartment. But at the same time, I did end up having a church that donated a bunch of food to me. And I ended up having some old friends from the military who ended up saying, "Hey, we just finished building a house. We heard through the grapevine that you want to go back to school. And if you want to come live with us, you and your son, and go back to school, we know that that's all you've ever talked about since we've known you."
Wow.
And so, I was just very, very fortunate. And I know that that was the power of manifestation, because I was praying night and day to have some deliverance and to have some help and to have a door that could open for me. And when those doors opened, I ran right into it and I went full force.
Wow. So then it's Thanksgiving Day, you get your first patient. What's the progression? Then you're starting to get in the flow, and then
Starting to get in the flow. And, I started with money I had literally saved in my shoebox. I literally started like that. And I printed out my own cards on an old printer and went door to door in the community and introduced myself to everyone. And because I didn't have money for marketing. And so I quickly grew practice. And within 3 years, I had grown to 3 practices. I was traveling around the world working with Olympic athletes, professional athletes, NFL players, PGL golfers, their families. And then the trifecta of the perfect storm happened. And I ended up losing my father to suicide. And I very soon after lost my other father to his, second and final stroke and heart attack. And I ended up getting some notices from the IRS that some things for the business had not been getting paid, and everything was going to be garnished. Everything was going to be taken from me. And the 2009, the crash in 2008 had happened. And by then this was 2009. And all this stuff was happening just a few months after the other. And, it was like one thing and then the other and then the other. And I could feel myself starting to get really, really sick from the stress and the pressure. And insurance reimbursement stopped. So I had, all of these patients. We had 3 beautiful clinics, and we were helping so many lives, and insurance stopped paying. And because they were denying claims. And so, even though there was no reason except for, because of the crash, everybody was holding onto their money. And I ended up losing the practices, but not before I became physically ill. And I woke up one morning and thought I had a stroke. And this was in the midst of all this stress. And I was just super panicked because, think about it, I had been working so hard, not just so much because I was ambitious, but because of the fear.
You're in survival mode.
Where I was. It was a survival thing. And I didn't realize that. Looking back now, that's what pushed me so hard, is because I wanted to run as far away from those struggles as I possibly could. I woke up thinking that I had had a stroke. I couldn't even pick my head up off the pillow because I couldn't tell which way was up. I couldn't speak, so I lost my ability to talk. I couldn't remember anything. I couldn't remember my son's name. I couldn't remember my name. And it was the scariest thing that had ever happened to me. And I became physically and mentally ill. And I ended up losing everything that I had. I lost all my practices. I had a radio show. I lost, I couldn't speak, so I lost that. The doctors didn't know what was wrong with me. So I kept getting these answers like, well, we don't know what's wrong with you. Or, it's all in your head. You're just stressed out. Go home and take the Xanax.
Doesn't that hurt? One thing I will say, when a doctor says that to you, it's like, I am in this struggle. I don't know how to fix myself, or I don't know. I'm shut down. I'm doing the best I can. I'm scared. And then they tell you that. No, it's not in your head.
Yeah. I couldn't believe that they were telling me that. I couldn't believe it. I said, let's do, I had to write it down, brain scan, CAT scan. Let's do these things. And we did have some scans done, and they weren't finding anything, which just blows me away. They just wanted to put me on several different medications. Long story short, I ended up, my son graduated and went off to college, and he was across the country, and I ended up losing my house. And all of this, doesn't happen overnight, right? I got very sick. Then I lost one clinic. Then I lost the second clinic. Then I lost the final clinic, right? And I'm watching this happening. It was like torture, which made me even more sick. And I ended up homeless. And I had only reached out to one couple. You see, everybody thought that, I had created this image of myself. And everyone thought that I was so ultra successful, that I was the single mom that just like was a go-getter, traveling around the world, working with Olympic athletes, doing all these amazing things and saving people's lives. And
Yeah, I bet you probably at this point couldn't even get the energy to ask for help or even have awareness that I need to ask for help.
well, at that point, I did reach out to one couple, and they just honestly didn't even know what to say.
Mm.
And I felt so ashamed. And I didn't tell my mother because she was still in shock from my father's suicide. And I didn't tell anyone else because of the stigma around being sick and mental health and losing everything, right? All of a sudden, I felt like nobody would want me or want to help me. And so I was living in my car. I lost my house, living in my car. And I was so sick and had been sick for so long and was finding no recovery for myself that I considered suicide.
Yeah.
And I was, that's the whole story of how I'm still here. That was, again, I feel like that was the universe jumping in, or God, jumping in and saying to me, you know what? No, I have plans for you.
Hmm.
And you just need to let go of this fear that you have,
Yeah.
because this fear that you've been living with all your life is what is crushing you. And that's okay, because I want to rewrite a whole nother life for you.
Hmm.
And so that's the whole story of how I ended up homeless and living out of my car with my dog and a hamper of clothes, and getting these, signs from the universe, in the midst of trying to take my own life. That's a whole nother story in and of itself, but it took me about 5 years to
Okay.
find my underlying causes and to create my own evidence-based systems so that I could heal myself. And I had multiple things that were going on. It was a combination of emotional traumas, right? And not having the resources to understand how to disconnect or how to cut the cord from that, that I was reliving and creating my own self.
Re-traumatizing. Yeah, and we get stuck in fight, flight, or freeze. And that's the shutdown. Your nervous system shuts down. It's like, I dissociate. I can't do it anymore. All the organ systems, your respiration, your heart, it just crashes. And
Yeah.
I want to hear what you did to explore those root causes. But I do want to address the subject. And it recently hit me when I lost somebody that I cared about who committed suicide. And I think it's the most unexplainable. It's so hard. Did you find anything through your loss of your father through suicide that could help somewhat ease your pain? For anyone who was watching who might have experienced this, did you find any solace or ways to soothe this pain? Because it's like, why did you take yourself from me? I knew somebody recently was a wonderful person, and he didn't reach out for help, and he's gone.
Yeah.
And
Yeah.
it just boggles our mind. How did you cope with that?
It was understanding and becoming aware that I had created a story around it that made it really bad for myself. And that's what we all do when we lose a loved one. We start creating stories in our head that are extremely painful, of, how much that they might have suffered. And then we can feel that pain. And, or maybe how lonely that they were, and how much that we're going to miss them and what our life is going to be like without them. So we create the tragedy. I'm not saying that it's not a tragedy. It is. But what makes it such a bad tragedy is that we create these stories that we attach to. And that's exactly what I had done. I started attaching to the pain that I assumed that my mother was having, because I could see the pain that she was in. I created the story of what my life was going to be like without him. And that created additional pain for me. And then I created the story around what he must have been going through before he did that, and how painful that was. And my body and my brain doesn't know the difference between the thoughts that I'm creating and what's reality. So I was literally making myself worse.
You know what, Elena, when I have my hands on people, we deal with this work, and it isn't until we go in and feel. And I tell you what, the body traps those emotions. The body, literally, the muscles are holding on to those stories and those memories. And when I work with people and they just get quiet into their body, these visions, these memories, these emotions start pouring out of the body. And this is where I'm so glad to have you here to look at this, because it's so many layers, so many layers, and hopefully we can shine awareness for people today.
Yeah, I think it's so important to do that. We are so powerful.
Mhm.
We are extremely powerful beings. I remember, growing up in church, and they would say how we were created in God's image. But, going through what I've been through and having the awareness that I have now, about, life in general, we are, we don't even understand what a powerful statement that is. Because we do create our own reality, and we can create our own reality, and we unknowingly create barriers and struggles in our life. And we don't know that just as easily we can turn 180 degrees and go in the other direction. And so, yeah, you're right. It's super important for us to bring awareness to that, so that people can understand that they can step out of their struggles. They can step out of the pain. They can step out of the trauma that they've been in. It's not that hard. You just have to have the right team of people around you to show you how to do it.
Yep. And sometimes it's doing whatever it takes. And I was talking to you before, and I'm doing some treatments right now, and they're costly, but I'm somehow, the ability to have them is being accessed through my insurance. And I just find that I'm very resourceful, and I always find a way. But there's this inner fire that we need to come up with. And sometimes when we're in that emotional state, the brain is negative and it's spinning and spinning and spinning. It's hard to get out of that cycle. And I want to ask you about what's hiding underneath that, the biochemistry of it, the neurotoxins that we're experiencing in our day.
Yeah.
What's going on? What did you find as your root causes?
Well, there are oftentimes a handful of root causes. But when we're talking about emotional trauma, and how that can change your brain chemistry, let's just touch on that for just a minute. Um, we have different parts of our brain. So to keep it really, really simple for the listeners, there are different parts of our brain that are responsible for different functions. So, for example, the back part of our brain is responsible for a lot of our motor functions. So the ability to move around and our eye-hand coordination and things like that. The frontal cortex here, it's a really large developed part of our brain. In humans, it's a bigger part of the brain than any other living being. And the front part of our brain allows us to reason.
Mm.
It allows us to understand actions and consequences, to decipher what's real and what's not, right? And then we have a tiny little area that's buried in the middle of our head here, and it's called the amygdala, and it's a very primitive part of our brain. And that part of our brain is what is typically only designed nowadays. Really, it's only needed for like fight or flight. Like if we're driving down the highway and a deer comes out in front of the road, that's going to trigger the amygdala. It's going to be that fight or flight. And we've got pathways that will go from our experience, i.e. what we're hearing or seeing at that moment. So like in this case, we're seeing the deer. We know, as soon as we see the deer, that fires a pathway right up to the fight or flight portion of the brain, the amygdala. The amygdala, all the alarms go off. Oh my God, oh my God, all right? But before the amygdala just takes charge of the whole situation, it then sends messages, it sends relays to the frontal cortex so that we can reason and go, oh my God, okay, the deer's facing this direction. I'm going to turn this direction. There's no car here. If I do this right, I can do this without flipping the car or hitting the deer or hitting anyone. And that's the frontal cortex. So you have this whole wiring system. So from the eyes, right? And the experience going into the amygdala, the fight or flight, all the alarms, the amygdala sending a relay back to the frontal cortex so that you can reason and decide what you need to do. And then after the threat is gone and you've made it past the deer, then your frontal cortex sends messages back to the amygdala, which, you know, goes into your emotional center that says, oh my God, I missed it, but everything's okay now. And then you just spend the next 15 minutes calming yourself back down. But when we have emotional traumas that happen to us, we experience something with our eyes, our ears, we hear, we see, we feel something that's traumatic. If that happens over and over, we can become in a state of what I call amygdala hijack, where we have alarms going off all the time. And eventually, the amygdala will not send as many signals to the frontal cortex to reason through it, to see, is this really real? Do I really need to be getting upset about this? And so you're literally rewiring your brain. And so that alone right there can change the brain chemistry.
Well, let me ask you this too, because I honestly have one of my worst fears is ever hitting an animal like that when I'm driving. And when you're talking about it, I'm feeling it and I'm getting a visceral response, a sympathetic response. So that goes the same with our thoughts and reliving traumas or imagining and anticipating the bad things to happen.
Exactly. So, you know, let's say that our child, that we witnessed our child getting mauled by a dog, super traumatic. And then we continue thinking about it and attaching to those feelings all the time. We are literally reliving that moment. Our brain doesn't know the difference. All our brain goes is, oh my God, the dog is attacking my child again. The brain doesn't realize that we just conjured that up because we were reliving that moment. And yes, so when you do that, you start to rewire your brain and you start creating more highways going from the emotional center to the fight or flight, and less highways going to the reasoning center of your brain. And it can create a real big problem because it's literally then causing a whole visceral response or change in your physiology of your body, not just in your brain chemistry.
Wow. That's great. Thank you so much for explaining that. I really appreciate it. Because I guess if I like to hear that, well, it's not just me, it's something going on in my brain. And what can we do to fix that? You know, I research to somatic experiencing. I do body work to help release those traumas with my clients.
Well, you know, that's a great question because we need to really look under the hood and start uncovering all the stones to see what's going on that could be adding to the problem. So I'll use my case as an example. There were a lot of things going on. So obviously there were some emotional traumas and I kept reliving it every day. Right. Every day I'd wake up and go, I lost everything. Oh my God. You know, I'm a loser.
Talk about your childhood. Like, I mean, I'm sure there's a lot of stuff when you were earlier that happened as well.
Of course there was. Just, you know, the typical dysfunctional American family. And so, but what some of the other underlying causes that were just adding to the problem were things like major leaky gut. So your dopamine and serotonin, for example, they're made in your gut. I didn't know that back then. A lot of us still don't know that. And so I was having some issues making some of my brain chemicals. I also discovered that I had some genetic mutations that were not only causing an inhibition for me to make dopamine and serotonin, but I had some other mutations that were not allowing me to convert my dopamine. So I was ending up with massively high levels of dopamine that was throwing me into a constant state of fight or flight. So even when I would try to change my thought processes, it was I was going up, it was like an uphill battle because once I realized I needed to disconnect from those feelings and not attach to those, I still had this underlying tremendous feeling of anxiety. And it turns out that I needed a special form of folate and a special form of B12 so that I could help my own engines in my body to work better so that I could start helping my own brain chemistry. So I started doing that. I started working with the leaky gut. I had some mercury toxicity, so I had to work on that because that was causing brain alterations as well, right? And so, I was able to, over the course of time, work on all of these different things, so that all the pieces of the puzzle could come together and I could heal. And that's what we do with our clients. Is when people come to us and they're struggling with anxiety, depression, PTSD with anxiety and depression, bipolar, schizophrenia, Parkinson's, Alzheimer's, like it doesn't matter what it is. There are oftentimes a handful of underlying causes, including emotional traumas and not understanding how to properly process our thoughts and emotions. And then genetics, glyphosate toxicity, or, like pesticide toxicity, we can test for that. And we can find that mold toxicity can cause massive alterations in brain chemistry. And so we start looking under the hood and we start addressing the body from a genetic and biochemical standpoint. And then we bring in experts like you to work on the repatterning aspect. And when we bring this evidence-based whole person approach, that's when lives start to change. And that's when people are able to finally get the answers and solutions that they need.
Well, I definitely love all that you're saying. You're awesome. I want to hear more and dive in because I'll just share a little of my experience. I know that I had the MTHFR gene mutation. And so I have not had a lot of experts who can speak to this, but I know that when I took methylfolate, it really helped clear me, as well as the COMT mutation. So would you mind sharing about that and what people can do to start getting tested for it? Or just to know, because this might be that missing key they need when the antidepressants aren't working. And that's a whole nother area to talk about as well.
It's a whole nother area to talk about. So genetics are changing people's lives by understanding that by looking at your genetics, it's not a doomsday. By looking at your genetics, we can understand how to get your body's systemic engines working again properly. So it's super, super empowering. We can change the expression of our genes and we can make the genetic engines work if we understand what's going on. So when we're talking about the MTHFR gene, a lot of people have heard of it. And I want to touch on that a little bit. So a lot of people will say, oh, I have MTHFR, I have MTHFR. And then they start doing Dr. Google and they start believing that because they have MTHFR, that they're going to have depression, have anxiety, have these autoimmune issues, have all these different problems. And that couldn't be further from the truth. Everybody has the MTHFR gene. It's just a gene that we have. We have to have it. It's a super important gene because it's driving over 250 different chemical reactions in the body. What we can have sometimes is an alteration in how that gene is formed. So, and we can call that a SNP. We can call that a variant, like a variation in the way that the gene is, or we can call it a mutation, whatever you want to call it. So people don't have MTHFR. We all have it. What people might have is a variation or a variant or a SNP or a mutation in their gene where the gene is like mal-expressing and it's just like that engine isn't working like it should. And so let's talk about that, because your MTHFR gene is not the only methylation gene. The MTHFR is a methylation gene and it's responsible for taking folate and converting it into a methyl group. And your body uses methyl groups like a car uses gas. Your body uses thousands of methyl groups every single day for over 250 different chemical reactions in the body, including the production of dopamine and serotonin for phase 1, phase 2 liver detox, so that your body can make enough mitochondria for cellular regeneration, for your thyroid to function. It uses it for so many different things. But if we have mutations in not only the MTHFR gene, but in all of the methylation genes, if we've got issues in any of those sequence of those methylation genes, we can have a problem where we're not able to uptake folate into the cell and then convert it many times to finally come out with this magical methyl group on the back end.
Mm.
And by looking at the genetics and looking at these sequence of methylation genes, there's about 15 of them that we like to look at, not just MTHFR. By looking at these, we can see where in the process of chemical reactions that there might be a little break, right? And so then we can understand, oh, we need to give you methylfolate, or we need to give you a higher dose of methylfolate. We can even understand if the body is having a hard time uptaking and utilizing B12 and getting it into the cell. And we can even determine if that individual should be taking a methylated B12 orally through their skin or sublingually. So because sometimes with certain genetic mutations, people need to bypass their gut altogether and they need to get it directly into their bloodstream. And so by addressing the methylation genes, that can totally change people's lives. And we're talking like brain chemistry imbalances. And for me, that was a huge one for me. Taking methylfolate and methyl B12, it literally saved my life.
So the frustrating part for me, and probably most people listening, is regular doctors are not addressing this. I had one doctor, it was a naturopathic doctor. He was an alternative guy, and he mentioned methylfolate. He said, just take methylfolate. That's literally how he said it. He didn't even test me. And I knew, and I don't want to get people the wrong idea to just take it. You can't just take it. You have to figure it out. How do we test for this? What do we ask our doctors for? How do we look at this? I get overwhelmed when I hear about the methylation process. I don't always understand it. I think a lot of people listening don't as well.
Well, let's go to the getting tested first, and then we can hit on that. We have to remember that our current medical model is not designed towards finding the underlying causes of people's conditions and diseases. The current medical model is designed to diagnose a condition or a disease once it's happened, right? And then what drug, surgery, or therapy fits into that diagnosis. And so, the first line of defense are pharmaceuticals. And the pharmaceuticals are designed to cover up the symptom. They're never designed and never have been designed to address the underlying cause of the problem. And so really that's where the problem is right there. If the system is only paying doctors to prescribe an antidepressant, right, for depression, and the insurance system isn't paying for the person to get tested to find out why they're having the depression, then obviously the doctor is not going to do the genetic testing, nor are they going to be getting any training on it. The good news is that there are many doctors around the country that you and I know personally who can do this testing. And it's about being resourceful and stepping outside the box. If you're looking for a different type of approach, you're going to have to step outside the box. It's going to be an out of expense cost for you. But you can find doctors who can do this testing for you. And it's a cheek swab. So it's very simple. Find someone who's well-versed in all of the methylation genes, not just someone who can test you for MTHFR, because they could be missing a much larger picture. And then you could be left feeling at the end, what if you don't have a mutation in your MTHFR gene? But what if you have mutations in every other methylation gene and your doctor missed it because they only checked MTHFR, and you come away with, again, thinking that you've had no answers? Find somebody who knows what they're doing. And as far as, taking a methylfolate, your doctor wasn't too far off when he told you to take the methylfolate, even if he didn't know. And let me explain why. 90%, and clinically we're seeing 95% of everyone who we're testing is coming back with mutations in their methylation genes. So if we're going to take a folate, which is a B vitamin, We all need B vitamins. Our body uses B vitamins like our body uses water, right? We need to be replenishing the B vitamins all the time. And the higher the stress levels and the more sick we are, our bodies burn through them even faster. So if you're going to invest in taking folate, you might as well invest in taking a methylated folate. It's just a special form of folate. Because if we do that, then you can cover all the bases, and you can make sure that just in case you are in that 95% of people that have the mutation and those genes are malexpressing and you're not able to uptake your folate and utilize it properly, just go ahead and just take a methylated folate. This way, at least you're covering your bases. So if you can't afford the testing, take a good source, a good brand of methylfolate. And then this way you're just covering all your bases.
Okay. So what is the name of the test with the cheek swab? Because I'm sure there's probably a few out there. Is there one that you like best that people can look for?
There are many out there. There are a lot of different companies, and there are a few different companies that we use, and we're actually getting ready to change companies again. But one of the companies is a company called GX Sciences. And you can order through a practitioner. So it's not a direct to consumer. You'll want to go through a practitioner. And really, you want to go through a practitioner anyway.
You won't understand it probably.
You're not going to understand it. You're going to go onto Dr. Google and you're going to come away and you're going to just, know enough to be dangerous to yourself and not really understand really what's going on, right? So GX Sciences has a great one. Dr. Kendall Stewart is a neurosurgeon, and he founded the company. And he does a lot in this field. I've been friends with him for, since he first started his company. And it's a very easy to read test that comes back. And it's not only testing for about 15 different methylation genes, it's testing for about 55 or 56 genes in total, this one particular panel that I'm referring to. So we can not only look at your methylation genes, we can look at your neurotransmitter genes like the COMT, which is responsible for primarily the production of dopamine and the conversion of dopamine into norepinephrine. It's going to look at your MAOA and MAOB, which primarily are going to be responsible for the production of your serotonin. For the breakdown of your serotonin. And then we'll be looking also at the GAD genes, the GAD, which is the genes that are responsible for driving the chemical reactions that help you to make GABA. And those genes can also, by the way, really give us some insight as to the best way to do gut repair for an individual as well.
I'm just blown away because it's like, okay, just take this antidepressant.
Yeah.
And they're not even checking in. That's mostly why those antidepressants aren't working, because it's not treating what's causing it.
That is so true. That's so true. Most of the antidepressants on the market are serotonin reuptake inhibitors. So what they're doing is they are preventing the breakdown of the serotonin when it's in the synapse. So for those of you listening, we have such interesting functions in our body. We are chemical and electrical beings. It's very interesting how that works. But we will have an electrical signal that will travel down a wire called an axon, and it'll get to the end of the wire. And before it crosses to the next wire, there's a space in there called a synapse. And that is where the electrical impulse then signals the chemicals inside of the space to help you to think and process and feel good and reason properly and not have anxiety and be able to deal with stress and all of that. And if you're having issues there, it's not always a serotonin issue. And most of the antidepressants on the market are SSRIs. They're designed to prevent the breakdown of serotonin in that space, in the synapse. But a lot of people find that those drugs don't work for them. And the reason
like a Band-Aid, like a little Band-Aid that's falling off all the time. It doesn't work,
Well, the reason why is because a lot of times it's not even a serotonin issue to begin with. It's not a serotonin problem. Sometimes it is, but it's not always a serotonin problem. It could be a dopamine problem or a GABA problem, or it could be a norepinephrine problem or an epinephrine problem. It could be so many other different brain chemicals that can make you feel anxiety and depression or brain fog or memory memory loss, and they're giving you the wrong medication, and they're giving you a medication based off your symptoms. They're not testing to see which brain chemical is it really, or what combination of brain chemicals is it. And, maybe we need to go back a little further. And if it is a serotonin problem, well, maybe preserving what's already in there isn't going to be the most effective answer. Maybe we need to figure out what ingredients that your body needs so that it can make more serotonin. And then you don't need to preserve the serotonin that's inside the synapse that's already there. Let's just go a few steps back. Let's go upstream and figure out, why isn't your body making the serotonin? And let's give your body what it needs so that it can make the serotonin.
There you go. And another area I want to throw in to really help, and from my perspective, is I treat cranially. So I feel structure is also important. That can be impacting the brain chemistry, the flow of the cellular synapses connecting. So I like to always share the skull is like, we have structural problems too in our body that can contribute. So that's something, getting body work can help, getting cranial sacral, seeing an osteopathic physician. I know when I would get my cranial bones adjusted, I would feel relief. So that's one thing. But now we also have to tie in the leaky gut, because if you've had antibiotics and we do have a toxic world, that's another area. So it is a fine balance, a fine line of figuring out what to treat first, how to do it. Looks like there's
That's absolutely true. That's absolutely true. I think starting with structure is so important. So, you're absolutely right. Getting the, craniosacral therapy, going to see a chiropractor or an osteopath who is doing a spinal and joint manipulation is going to be so important for you. We are a very interesting makeup of energy, chemicals, but we live inside of a frame, of a structural frame.
And I want to show you this too, because we think about, our nervous system, we have our skull, we have our brain inside, the spinal cord travels down. And I do a treatment, I'll mention it here because a lot of people don't know about it. It's pelvic floor treatment. So we have muscles down there. And if you've had a fall on your tailbone, if you've had C-sections or episiotomy scars or a hysterectomy, all of that, I feel it just clamps down and locks the nervous system. And then you can also stay in fight or flight, or just an inability to settle. So when I help release the pelvic diaphragm and the respiratory, the breathing diaphragm, it's like your world can change as well.
That's absolutely true.
I have to tell you, I don't know if you're recommending that in your practice, and you put what, where, yes, I work internally on people. It's like a gynecology exam, or rectally on men, and it just frees up the system in a different way. So that's another discipline area that you could look at to treat your body.
You have to treat structure. It's absolutely critical. If you're not addressing the structure, then you're inhibiting the nerve flow. And if you're inhibiting the nerve flow, then the body can't talk to the brain, and the brain can't talk to the body, and you're going to end up having, a series of short circuits in your body and in your brain. So you absolutely have to.
They're disconnected. They're dissociated. When I work on people, they come in all up in their head, just like a pinball machine going off, and we have to get them into their body. But when I'm holding and you're so stressed out, you're empty. I can't feel you. It's kind of cold. So I have to use some psychology basically to get you back into your body. And when you have these emotional hurts and upsets, I'm sure, I'm visiting you in the car homeless. I mean, what was your body like? I could just imagine your head was like just cranking up this activity and fear.
Oh my gosh. I don't even know. I don't even know how, if anybody had been in close proximity to me, I'm sure they could have, smelled the fear coming off of my body and the stress.
Mode. I mean, I bet it's hard to you can kind of imagine what it felt like, but if you go back where you just completely, I would imagine, dissociated a bit.
That's a survival mechanism.
Yeah.
Right? It's a survival mechanism. And I absolutely did.
And I did it in my car accident. I remember therapists in my training, my myofascial trainings, is get back in your body. You're not there. You're not there. And sometimes I'm like, I don't know how to be. So I do this with my clients when they're really out of their body. I'll say, go up to the ceiling and imagine you're looking down at yourself. And then there's this unraveling and unwinding. It's really beautiful. But that is the body work, getting in meditation, guided imagery, that can really help as well.
Oh, absolutely.
So So
Absolutely.
methylation and then leaky gut is another thing. And how many people have that? Most people?
Most people do. Absolutely. They do. And, once we've taken a patient through the process of getting their body and their brain restored, which includes gut work, then we have taught them how to maintain their gut. We are exposed to variables on a daily basis that is going to slowly tear down the ecosystem or the gut biome, and so we just have to constantly be working on it. We can't live in a bubble, and so we do have environmental toxins that we're exposed to. We are going to go out to eat and we're going to end up eating non-organic foods that are laden with glyphosate and other toxins. There is going to be stress. There are going to be exposures that we're going to have, and it's just it just takes. We have to treat our body like we treat a high performance sports car. We're okay putting so much money into things, tangible items that we love. Oh, my car is just high maintenance, but I love it. My motorcycle's high maintenance, but I love it. Or my daughter is high maintenance, with getting her nails done and her hair done and all that. And we're okay with spending that money. But we need to be okay with spending money to do things for our maintenance that is really going to make a difference for our health, to really be able to heal ourselves and to maintain ourselves. And if that means that we need to spend a little bit of money each year to buy some additional fermented foods and buy some gut repair powders that we spend 4 weeks out of every year doing it to maintain, then so be it. Because what you're going to get on the back end, right, are the huge rewards with your health and your mental health. Your mental health and physical health. You have nothing if you don't have your health.
Yep. Once I got my gut cleared and I did a parasite protocol, candida protocol, bacteria, I was driving and I'm singing and I'm happy and I'm like, oh my God, this feels amazing. It's worth every penny, but I think a lot of people have tried so much, and that's one of my series was pain treatments that work, how to heal when you've tried everything else. I get people, they're frustrated. They don't believe anymore. They don't want to spend any more money because it's just not working. So that's another thing. But if you can just get the right practitioner, and you have tons of great resources on your website I looked at, then you can really, really thrive.
Then you can thrive. For people who have been trying things, they've either tried on their own or they've tried with other doctors and it hasn't worked. There's no reason for you to give up.
Mm-hmm.
There are evidence-based models out there now. That's what we do. We have an evidence-based model. If you come to us and you're not feeling well, we're going to run so many labs on you, it's going to make your head spin. We're going to find all of the underlying causes. Do you have Aspergillus mold? How much glyphosate do you have? Do you have PFAS toxicity, in your body? What other environmental toxins do you have? Do you have patterns of leaky gut? What's going on with your immune system? And everything that we find, and as we start addressing it, we're going to retest you. And we're going to retest you, and we're going to retest you until we see that the test comes out clean. So, for example, if you have, ochratoxin mold in your body and you're experiencing Parkinson's symptoms, and we've tested everything, and that's the main thing that we're finding, we're going to start you on protocols, and we're going to retest that about every 12 weeks.
So what is that called again? Okra?
Ochratoxin. It's a mycotoxin. It's a mold. It's a toxic mold. So so my point is that whatever we find on the labs, the data doesn't lie. Whatever we find on the labs, let's say that we found ochratoxin, for example, as we start working on it and we retest the patient, we will start seeing that the levels are coming down, and they're coming down, and they're coming down, and they're coming down until they're gone. So yes, it's important, obviously, that the client starts to feel better, but the data doesn't lie. And as they see that the toxin is coming out of their body, like the ochratoxin in this example, they will see how their body will start changing, and we'll see how their labs will start to change, like their dopamine level will start coming into balance as the mold toxin is eliminated out of their body. So, it's just incredible. And so, for people who haven't had the best experience, or who are just like, oh my God, I just don't know what to do, I just give up, whatever, find somebody who's going to bring some data to the table, because the data doesn't lie. And if we can look at the data, then we can bring a very evidence-based, data-driven approach so that we can then, fix the underlying problems.
Okay, and is a lot of this covered in your free gift, your ebook, 13-Step Formula to Balancing Your Brain Chemistry?
We talk a lot about underlying causes. Yeah, so we talk a lot about underlying causes, and then we give very, very simple solutions that people can start to implement. So what I've done in that book is I've kept it really simple. And for some, it might be too simple because they're going to go, oh, right, drink purified water because fluoride, can cause problems. But, you know, if for those of you who want more information or more proof, that's where you can, jump into our 5-part series that we're showing we've been showing replays of it, but we do master classes and we show all the evidence and all of the scientific peer reviewed journals showing how, for example, why you need to drink purified water because fluoride, actually, inhibits different receptor sites on the brain, leading to neurological issues. So it is, in fact, a neurotoxin. But in the 13-step ebook, we just try to keep it simple. And we go, okay, fluoride is a culprit. Drink purified water. Don't use fluoride in your toothpaste. Work on your gut. And so, yeah, that's a great place for people to start. We make it very clear and very, very easy for people with that ebook.
Okay, awesome. So, okay, we've covered a lot. So just wrapping it up. So definitely looking at your genes, because that's a huge factor for depression, anxiety, neurological conditions. Leaky gut, getting your gut cleared up, looking at structural issues. What else have we missed? Hormones. Okay. Can you jump into stress and cortisol and how it impacts hormones? Because I find a lot of my clients in their 50s or older are not, once they're past menopause, they're not getting tested with their hormones. And I know that can really keep someone feeling stuck.
So that is one of the many tests that we do, is to look at people's hormones. But I think it's really important to really be able to understand and decipher when a hormone is out of balance or deficient simply because of someone's age. Like maybe the 70-year-old female having a lower level of progesterone, for example. That's going to be, most of the time, that's going to be more age related than anything else. And it's a very easy fix versus the, woman in her 30s or 40s whose hormones are who is bottomed out on progesterone. What's the real underlying cause? There are toxins in our foods, for example, that are major endocrine or hormone disruptors. So we need to just, again, we need to go upstream and we need to figure out, if we see a hormone imbalance, what's the underlying cause of that? So stress can be an underlying cause of hormone imbalance. Lack of sleep can be a cause of hormone imbalance. Environmental toxins that we're very commonly exposed to on a daily basis can be a cause. And so can our household products and our skin creams and our makeups. We have seen young women in college that have had massive imbalances in their hormones, stopped having their periods, and started having massive testosterone dominance. And it turned out it was a mascara that they were using that was to elongate their eyelashes and make their eyelashes longer. It was having a side effect of creating this testosterone dominance in their body. And it basically made them infertile. But once we figured out what the problem was, now their doctors tried to diagnose them with PCOS and put them on birth control. But we found out what the underlying cause really was, and it was their mascara. And once we got them off the mascara and change their foods, make sure they weren't having those toxic exposures, with both of these girls, it took about a year to get their periods back. But we got their hormones back in balance. We got their body detoxed from all the toxins, and everything happened. So it's underlying causes can be many. We've got genetics, hormones, but what's causing the hormone imbalances? Environmental toxins, mold, parasite infections, bacteria infections, right? And so, we just want to take a look and see what's going on under the hood.
Wow. Yes. And I want to touch upon a treatment I've recently tried, and it was pretty powerful for me. It's not for everyone, and everyone has their own experience, but ketamine. What do you know about ketamine injections? It's the latest. They're doing intravenous ketamine for treatment of trauma. I know there was a clinical trial, 6 doses given over a 2-week period. They found success with treating depression and trauma.
My opinion on ketamine is that if it's used in the right environment
Mhm.
with the right team of therapists, that ketamine can be very useful. My big concern is now that this has gone on the market as a treatment, so to speak, for depression, is that doctors, are going to be prescribing it to their patients, and the patients are going to go home and take the ketamine and dissociate. Because that's what the ketamine does. It causes you to dissociate from your feelings. But while they are in a state of dissociation, they're not being taken through the journey of being able to become aware, and actually heal while they're in a state of dissociation. And then when the medication wears off, they go right back to where they were before. And so, I feel like ketamine can be a big game changer for people, especially those who have undergone some severe emotional traumas in their life and who are stuck in that loop, in that circle, because they can't detach from their feelings. It can be a lifesaver, but it needs to be done in the right environment with the team of therapists, so that while they are in a state of dissociation, they can be taken through that journey so that they can really heal, because that's not a long-term fix.
Right. And so there's two ways I believe it's administered. This is the medication that you go to your doctor and they administer in office. It's just recently been FDA approved, right? It's a nasal. So you could do nasal, or you can be in the office for the hour and get the IV drip. And it's psychedelic experience. Your mind wanders. But yes, if you don't have someone guiding you through that, or you haven't done your own research and studying first, it's just going to be an experience, and then you don't even integrate it. And it's about the integration. Because
Absolutely.
images will come up. I've had images of family members that I have strife with. Relationship hurts that have happened. I can see the person there in front of me, and I look at it and it's like, oh, this is just a story I'm telling myself. I don't have the attachment and the emotion and all the drama around that relationship. It's just like, he has his problems, I have mine, and it's okay. We are okay. It was just a beautiful experience. And I want to bring this up to people. It's pricey. It's not cheap. I believe the ketamine nasal is paid for through insurance, not the IV injections. It could be $400 to $500 a treatment. But if you're really desperate, but looking at the genes, looking at your gut also, it's not one thing.
Exactly. It's never one thing. It's usually a combination of things that need to be discovered and then addressed.
Yeah. Well, thank you so much. I think this was a great interview to give strength and hope to people. And they might need to say, where do I start? Where do I start? Do you have some steps just so they can not feel overwhelmed with this information?
Yeah, just remember that you are not broken.
Yeah.
There are answers and there are solutions. And just being a part of of this podcast and getting to learn from us, this is the place to start. You can find, I'm not the only practitioner that brings data driven and evidence based approaches into this type of work, but you're welcome to reach out to me if you want. You can go to balanceyourbrain.com for the ebook. You can visit modernholistichealth.com, and you're welcome to check out and see a little bit more detail on the way that we approach stuff. But just start one day at a time. Take a deep breath. Mm-hmm. and take some time to journal, take some time to get outside, start cleaning up your diet and your lifestyle, because those are foundations that if you're going to have success working with any expert, that they're going to want to get you started with those things in the very beginning anyways.
Absolutely. Thank you so much, Dr. V, for sharing your story and sharing the path that you took, and in a way, a path that someone else who's struggling here can take as well. Thank you so much.
Thank you. You have a wonderful day.
Thank you so much, Dr. V, for really putting it into perspective. Sometimes antidepressants aren't the answer. It's not going to just wipe away the depression, the anxiety, the brain disorders. It really is looking for that root cause. And I hope that I was able to bring some new awarenesses into your brain, into your world with my interview with Dr. V, especially looking at your gene mutations and if they could be impacting your mental health and your brain's ability to grow and be healthy and rewire. Now, if you love this interview, I know I did, and there's so many great interviews in this series, consider purchasing the bundle package here. And what it includes is a lot of wonderful bonuses, including me teaching 5 days of mapping trauma in your body, where you can fully immerse and look at some of those hidden traumas in your own life. And also you'll get a one-on-one session, 45 minutes with me on video like this, where you'll fill out a form, we'll get all the details of your history and help you put together the pieces and uncover those hidden traumas that might be keeping you stuck. All right, have a beautiful day, and I hope you are feeling inspired from this series.